Hi there, you're watching the World Healthcare Congress Interview Zone. I'm so pleased to have with me Dr. Rushika Fernandopulle, founder of Iora Health. Dr. Fernandopulle, great to see you.
Thank you, great to see you again too.
Well, I just wanted to introduce everyone to Iora Health and to talk about why this is a different model of healthcare.
So what we're trying to do is actually start from scratch and build a new model of delivering care. I think what a lot of the world is doing what I would call top-down reform, starting with the government trying to tell us things and big health systems forming accountable care organizations and somehow hoping that'll trickle down. The fundamental issue is that unless we change how individual patients get individual care, nothing actually changes. And we're starting bottom up, starting with primary care. And our model is very different. We change everything, change the payment model. So instead of getting paid per sick visit, we get paid essentially to keep people healthy and out of the hospital. We change the delivery model so that we build teams around patients and work on proactively managing populations, not seeing one patient at a time. And then we try and change the IT system to allow us to do all of these things.
And you also have very good follow-up throughout the whole process, is that right? So you're making sure that the system is in place, it's working, and patients are being covered correctly.
Absolutely, there are two pieces of that. One is sort of the data and the IT systems to give us feedback, so we know when people are getting into trouble and know how they're doing. And the other is people, we call them health coaches, who can reach out and interact with patients and get them back on the straight and narrow. And I think they're both important, the people and the technology.
Well, tell me how you were able to determine that this works. You had pilot programs, for instance.
Yes, we've done a number of projects. Typically what we do is we work with a self-insured purchaser of care. Did a pilot with the Boeing company, did a pilot with the Casino Workers Union in Atlantic City, for instance, and get them to pay us differently to deliver care in a different way. And we build a new primary care practice for their folks and get them to vote with their feet and deliver care differently. And we've been doing that for several years. It started in about 2007 and have great data that patients like it. Of course they like it. Outcomes are much better. We can improve their diabetes, their hypertension, get people to quit smoking. And in addition, we can dramatically reduce utilization. So relative to a control group, can reduce emergency room visits in half, can reduce hospitalizations by 40%, and therefore drop the cost of care net by 15 or 20%.
And what's in it for the physicians who traditionally have been paid for treatments, procedures? Now they're being evaluated in a different way.
Right, so now we're sort of getting paid for value, which is what we should be doing, is keeping people healthy and out of trouble. And what's in it for physicians is actually not necessarily more money, though it could be if we wanted it to. It really is a better way to practice. I think many of us, or hopefully all of us, went to medical school because we want to take care of people and want to do the right thing and have the right tools to be able to do so. And in the typical system, we don't have it. A colleague of mine once looked me in the eye and said, you know, every day I lose a little piece of my soul, because I want to help these people in front of me and I have 8 minutes and I don't have the resources to do what needs to be done. I think our doctors feel like they do.
Okay. How about expansion? How are you finding your new customer bases? How are you expanding Iora Health?
Yeah, so we're going out and actually people are coming to us and saying we're tired of the value we're getting from what we're buying for healthcare and we're willing to make a big step. Again, what most people in healthcare have been doing is trying to work with the existing models, existing practices to try and cajole, convince, whatever word you want to use, have them get better. And it's really hard. And I think people are now willing to say, let's start over from scratch and try and do something different, both because doing that will improve care for the people in your practice, but also it's going to give a little bit of a kick in the butt to the people who are out there realizing they have to change. A little way we think of ourselves as Southwest Airlines. Right? So what changed the U.S. airline industry in the 1970s and 80s? It wasn't consultants, it wasn't conferences, it was people actually just doing it better, letting customers vote with their feet.
Competition.
Exactly.
Now, what are you finding that this is a perfect environment to grow? Because people are looking for new ways to do things better. Iora Health is right there.
Yeah, I think you're right. And we've been doing this for a long time. I think for a long time we were maybe a little bit ahead of the market. And people were interested in talking about it, but weren't willing or, to be honest, had the guts to pull the trigger. I think now we're getting a lot more interest. We've opened 4 practices in the past year. We're hoping to open at least 4 more in this current year. And getting much more interest in saying, look, we're tired of the way it's working now. Let's try something different.
So what needs to be in place to partner up with Iora Health?
So we need to have a payer. We need to have someone who's on the hook for healthcare costs, who's willing and able to pay us differently, to say, let's get beyond this fee-for-service, pay-per-sick visit, and pay you a different way. Typically sort of a flat fee for primary care. And then a population of people who we can serve in a given geography.
Okay, and where are you getting most of your inquiries from?
You know, it really varies from a couple groups. So self-insured companies. So I mentioned the Boeing company. We have a project with Dartmouth College up in Hanover, New Hampshire,
Yes.
and they're on the hook for healthcare costs, and they've been going up every year for the past 10 years, and that's no longer acceptable. Union trusts are a particular group we've had a lot of interest with, and we have a number of projects with union trusts. The hotel workers in Las Vegas, we have with the Carpenters Union in Boston, and union trusts, the way it works is they get a fixed amount of money that pays for benefits plus salaries. So if healthcare costs go up, they have to not be able to give people raises. So again, the union we worked with in Atlantic City, for instance, for 7 years they couldn't give people raises because every cent of the increased compensation they negotiated had to go to healthcare costs. Wow. And when you're a poor, uneducated maid and you're an elected union leader, that's not tolerable anymore.
Right.
And again, because of our practice, they actually we lowered healthcare costs and they put 50 cents an hour back in people's paycheck.
Right.
Big deal when you're making minimum wage.
Absolutely, absolutely.
We've just started to get some inquiries from health plans.
Okay.
You know, I think the problem with health plans is they tend to be big and bureaucratic and have difficulty moving.
Yes.
And have now started to do some projects with what I call patient aggregators. So we have a project very interesting in Brooklyn, New York with a group called the Freelancers Insurance Company. And what they do is they sell individual insurance to people who are freelancers. They are yoga teachers, artists, guitar instructors who buy policies themselves. And what they've done is they've bundled our practice, Freelancers Medical, with an insurance product and sell it as one package to individuals. And it's very compelling. We had 2,200 people sign up in 4 weeks, and then we had to cap it because we needed to hire more staff.
Right. Now, do you brand the collaboration if you do partner up with someone? Do you brand it under Iora Health or under the original name that it came to the market with?
Yes, our practices are really branded for we call them our sponsor.
Okay.
So our practice in Las Vegas is called the Culinary Extra Clinic because of the Culinary Union. The practice in New York is the Freelancers Medical because it's a freelancers insurance company.
I see.
The practice in Hanover is Dartmouth Health Connect.
Okay.
Now, in small letters below it is an Iora Health practice.
Okay.
So we like a sort of a small brand, but this is really trying to drive our sponsors, and they have the relationship with the patient.
And you come in and build the system.
Right, so we build the system, we hire the staff, and we run it.
Okay.
Again, to do this is an execution game. Like what we're doing is building a service business. And it's not the 10,000-foot stuff that's important. I think that's pretty obvious to people what you do. It's the 10,000 little decisions you've got to make on the ground. How do you execute on it? And that's, I think, what we've gotten good at.
All right, great to hear.
Great.
Dr. Fernandopulle, great to see you, and we look forward to another update soon.
Thank you very much, Mabel.
Okay, thank you. And I'm Mabel Zhang. Thanks so much for watching.